Hi sir, I am Krixan MC Dayaw and I will be your student nurse for today. So, may I know your name, sir?
So my name is Carlos Sidayaw.
And your birth date, sir?
July 11, 2001.
May I also know your current age?
20.
So, for today, sir, I will be assessing your musculoskeletal in the upper extremities, in which we will be checking if there are abnormalities. And rest assured that the data that I will be taking from this assessment will be taken in a great confidentiality between you and me and to other healthcare providers that are directly involved in your care. If you have questions, clarifications, or if you are uncomfortable with the procedures, you can just tell and ask me. Okay, sir?
Okay.
So I will be just checking if I have the materials needed. So I have all here and I will be just performing hand hygiene. Okay. Just putting it here. And I will be providing you privacy, closing the curtains. And then first, sir, I will be inspecting your hands and your arms. So, as well as I will be palpating it. So, upon inspection and palpation, there are no tenderness, swelling, and it is symmetric. And then next, sir, I will be also inspecting and palpating your shoulders. So, kindly face there first, sir. Okay, and I will be palpating it. Okay, and sir, kindly shrug your shoulders. Just like that. And I will be putting some resistance and you must resist it. Okay. Okay, sir. You may go back to your position. So, when I check for the shoulder of the patient is symmetrically round. There are no swelling and it is symmetrically round and no swelling noted. And then that's it. And then next, when I check for the palpation, when I palpate it, there are no tenderness, swelling, and also no heat. And then when I check for the muscle strength, the muscle strength is 5, which means that there the muscle strength is functioning normally and is able to maintain its position even when resistance is applied. And then next, sir, is the range of motion exercise. So kindly stand, sir. Stand here, sir. Stand here, sir. So first is the flexion, extension, hyperextension, and then next is abduction, adduction, down, sir. And then next is rotation, internal rotation, external rotation. Okay, kindly repeat it, sir. So first is flexion, extension, hyperextension, and then abduction, adduction. Just here, sir. Okay, and then next, internal rotation, external rotation. Here, sir. Okay, so it's okay, sir. You may take your seat. range of exercise is against resistance, and the client was able to perform it without any difficulties. Okay, so next, sir, is your elbows. May I inspect it and also palpate it? Do you feel any pain, sir? Okay, so when I inspect the elbows are symmetric. It is symmetric and no swelling noted, as well as upon palpation there are also no nodules, no redness, and no swelling or tenderness noted. So next is the range of motion exercise. So follow me, sir. Flexion, extension, pronation, supination. So again, sir, flexion, extension, pronation, supination. So when we perform the range of exercise for the elbows, the patient was able to perform full range of exercise against resistance and able to perform it without any difficulty. And then next is the muscle strength. I will be putting some resistance and you must resist it. Okay? Okay, sir. How about your other hand? I will be putting resistance and you must resist it. Okay, so when I check for the muscle strength, it is scaled as 5. This means that the patient muscle strength in the elbows is functioning normally and is able to maintain its position even when resistance is applied. And then next, sir, is your hands and your wrist and your fingers. So I will be inspecting it as well as palpate it. So okay, do you feel any pain, sir?
No, ma'am.
And other one, you feel any pain, sir?
No, ma'am.
So when I inspect the hands and wrist, the wrist is in slight extension and there are no swelling and no swelling, no redness noted. And then when I palpate it, there are also no swelling, no tenderness, no nodules noted. And then next is we will be checking for the phalanx test. Here, sir, at the top. No. Sir, oh. Not here, not here, sir, but it's here. Yan. Okay. Try to hold it for 30 to 60 seconds. Okay. Okay, sir. How did you feel, sir? None?
None.
So, when we test the phalanx test, there is no, according to the patient, there is no complaint of tingling, sensation, numbness, or pain after the test. So, next, sir, is the range of motion exercise in your fingers first. So, is kindly follow with your hands. So, this is flexion, extension, hyperextension, and then abduction here, and adduction. Open. I wait. Yeah, adduction. So this is abduction and adduction. I'm sorry, sir. So first is, let's repeat it. So flexion, flexion, extension, hyperextension, abduction, open it, and adduction. Okay, so when we perform the range of motion exercise, um, full range of full range of full full range of motion exercise was performed against resistance, and the patient was able to perform it without any difficulties. And then next is the wrist. Wait. That's for the hands. So put here, sir. So just like that, flexion. Here, sir. Yan. Flexion. And then extension. Hyperextension. And then radial deviation. And then ulnar deviation. Okay, sir. So when we also perform the full range of exercise in the wrist, full range of exercise against resistance, and the client was able to perform it without any difficulties. So next is I will be putting some resistance on your hands, on your wrist, and you must resist it. Okay, sir. Okay, next. And in your fingers, I will try to separate them, and you must put resistance. Okay. 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 Next. Okay. So when I check for the muscle strength of the fingers and the wrist, it is scaled as 5, which means that the muscle strength is functioning normally, and he was able to maintain the position even when the resistance is applied. So next, sir, is I will be also checking for the light touch sensation in the neurologic function. Neurologic function, in which I will be asking you to close your eyes, sir, and then identify the dull and the sharp sensation. So first, sir, this is a dull sensation. Dull sensation, and then sharp sensation. Okay, sir? So, what is this, sir?
Dull sensation. Sharp sensation. Sharp sensation.
And sir, you tell me if this object will hurt you. You may say yes or no.
Yes. Yes, it's certain. Yes. Yes.
Okay, so next is I will be putting some hot and cold object, and you identify the temperature if it's hot. So let's pretend this is hot and this is cold. So this is cold, sir, and this is hot. Okay, so
It is hot. It is hot.
sir, let me reiterate. So this is cold and this is hot. Okay, so what is this?
It is cold. It is hot. It is hot. It is cold.
Okay, you may now open your eyes. So the patient was able to identify and differentiate the sharp and dull sensation, and also as well as the hot and cold temperature. And then next, sir, is I will be also checking the position and the vibration. Vibration of the of this tuning fork. Okay, so first in your wrist. So tell me if you feel the vibration. Okay, so let's pretend that this is a tuning fork. So do you feel, sir?
Yes, ma'am.
You feel, sir?
I feel it.
How about here, sir?
I feel it.
Here, sir.
Yep. Yep.
Okay, sir. And then next is I will be asking you to close your eyes again and identify if I positioned your fingers upward or downward. Okay.
Downward. Upward. Upward. Downward.
Okay, you may now open your eyes. So the patient was able to identify the type of sensation, type of position that I have moved. And then next, sir, is I will be also inspecting the stereognosis test, in which I will be asking you to close your eyes, and I will be putting some I will be putting some objects. So kindly close your eyes, sir. So first, you may touch it, sir, and feel it. What's that, sir?
It is a key.
Okay. How about this, sir?
It's a pen.
And next, sir.
It is fork.
Okay, you may now open your eyes. So when we check the stereognosis test, the patient was able to identify the object that is placed in his hands. Now next is the graphesthesia test next. The graphesthesia test, in which I will be asking you to close your eyes and identify the numbers that I will be writing in your palms. Okay, close your eyes.
6, 5, 3, 4, 6, 6, 8, 6, 6, 9, 9, 6.
So, sir, you have complicated. You are complicated with 9 and 6, but when I try it again, you were able to overcome it. So, when I check for the graphesthesia test, the patient was able to identify the numbers that are written in the palms. And then next is I will be also testing the 2-point discrimination, in which I will be asking you to close your eyes, sir, and tell me if the object that I will be tapping is 2 point. So example is just like that. Okay, so sir, is it a 2 point?
2, 1,
Look again, sir.
2, 2, 1, 1, 1,
Next.
2, 1,
Wait, sir.
1, 1, 1.
Okay, so when we check for the 2-point discrimination, the patient was not able to identify the 2-point discrimination at 40 mm. So next, sir, is the extinction, in which I will be touching you just like this. Close. I will be asking you to close your eyes. Wait first. Touching. If I touch this, you must also touch it. So, for example, I touch this, and you must also touch it. Okay, to point out. So close your eyes, sir. So
Left and right.
Nope, sir. Touch your body, okay?
Sige, sige.
Okay, so when we perform the extinction, when we test the extinction, the patient was also able to point out the areas of the body that I touch. And then next is the reflex test. Let's presume that this is a reflex hammer. Okay, so first is your biceps brachii. Okay, and your core. Okay, so when we check for here. Okay, so when we check for the reflex of the hands, there is a reflex contraction in biceps, brachii, triceps, and brachioradialis. And then next, sir, is we will be also checking for the cerebellar function. Okay, in which I will be asking you, sir, to touch your anterior leg, lower leg, and then do like this as fast as you can. Okay. Okay, stop it now, sir. So when we check for the palm and lower anterior lower leg, there is a coordination. There is a presence of coordination, equal turning of hands, and also it is quick and accurate. So next, sir, is currently backwards is you will be touching your finger pads. Then from pointers to pinky, 1, 2, 3, and pinky to pointers with your other hand, sir. So the patient was able to do it quick and accurate. So next, sir, is the finger to finger, in which you will be touching your nose. You will be touching your nose, and I put my hands here, and you will be from your nose. You will touch it, my fingers. Okay. So example, put your fingers there, sir, and no. For example, me here, and then I will be touching your fingers. So, but that's for you, okay, sir? So touch your fingers, okay? So touch my fingers. Kindly use your hand. Okay, touch my fingers as fast as you can, sir. How about your other hand? Okay, sir. So the patient was able to do it smooth and accurate. Next, sir, is you close your eyes and then touch your wait, sir, open your eyes, sir. Touch your nose just like this as fast as you can, closing your eyes. Tip of your nose. So wait, sir. 1, 2, 3, go. As fast as you can, sir. Okay, sir. So the patient was able to do it accurate and smooth. So that's it, sir. Thank you for your cooperation, and I will be just document what we have done today. Okay.